It's 11:32, and you are listening to the Mid-Morning Talk on Salam Media with me, Mara Mukanda. So on today's health segment, we are talking oral hygiene, a topic that we haven't really covered on this segment, and I'm glad that we are tackling it today because it's now or never. And the topic of discussion is periodontitis, a gum infection. Now, I don't know much about these huge words that you have to break up in order to grasp it, and then you have to Google it in order to find out what it means and what is this and how to get it, what are the symptoms, etc. But we do have dentists on the other side of the stream, Dr. Jacinta Gounden and Dr. Vallabh, who are joining me to tell us more. Good morning to the both of you, and thank you for joining me.
Hi, John.
Hi. Shukran so much for having us, Miriam.
It's a pleasure. All right, let's start off by telling us what is periodontitis and where does it come from?
Okay, so periodontitis basically starts off as gingivitis, which is an inflammation of the gum and the gum tissues. And if it's not treated, it then progresses to affect the supporting structures of the tooth, which is the gum, the bone, and the ligaments that hold the tooth. So basically, they would swell up, and then we would eventually have swollen gums, the bone levels start to decrease, and then we end up eventually having loose teeth and ultimately end up losing the tooth. So that is basically what is periodontitis.
And what causes periodontitis? What causes gum diseases like periodontitis?
Okay, so periodontitis is mainly caused by bacterial infection. Yeah, so we do have normal bacteria in the mouth and that, but that is now aggravated by having poor oral hygiene or other conditions like being a smoker, having diabetes or type 2 diabetes, conditions where you have a diet which is deficient in certain vitamins, as well as hormonal changes and that. So the bacteria, which is normally in the mouth and that, it just gets aggravated when our immune systems and that drop, or by these other, factors. Yeah.
Dr. Vallabh, who is more at risk for getting periodontitis?
Okay, so there is different types of periodontitis. One which is called aggressive periodontitis usually happens in patients who are, clinically healthy. Yeah, so the factors, like I said, would be that you are a smoker, you have diabetes, you have your immunocompromised, your diet plays a major factor as well as hormonal changes. So it can be any person as well, like who's clinically healthy, but then has a history of it as well, like hereditary. So it can be in a healthy patient, or it can be in a patient who has one of these factors.
Dr. Gounden, what are the symptoms of periodontitis that we should be aware of?
Okay, so I think the basic and the most common symptom is that patients will come to us and say that they have bleeding gums. That is the most common feature. You'll find that when you either brushing your teeth or sometimes even chewing on a food that is quite hard, then you get bleeding gums and so forth. So that's the first sign. The other sign could be, bad breath. We also have loose teeth, which is it is a progressive sign and symptom, but it does show that you have perio. We have, swollen gums. It would appear more red. Yeah, those are some of the signs. Any other signs? But basically, that's what it is: more bleeding gums and
Pain.
Pain is exactly pain on biting. You sometimes in more progressive stages, patients will say that when they bite, there's a bad smell, or they sometimes see a little bit of pus draining and so forth. Yes, but those are the common signs and symptoms of perio.
Okay, I think a lot of us experience some of these symptoms, especially like the bleeding gums when we brush now and then, and we don't really take it into consideration because we feel like, oh no, it's nothing serious, it's normal, and it will probably go away after some time. Is there any truth to that? Should we be concerned if we do have bleeding gums?
So definitely bleeding gums is the first sign of gingivitis, which then progresses to periodontitis. Why? Why the gums are bleeding is because the bacteria that's in the dirt, or let's just start off by saying that dirt that starts up in the mouth by being food debris and bacteria then accumulates on the teeth, which is then first your plaque, and your plaque is a softish layer. Sometimes you can see that white layer, which is scrapable. And once that progresses or hardens or calcifies to become tartar or calculus, that's now the problematic part because that cannot be removed by just simply brushing your teeth. And what that does, because it contains your bacteria and food debris and all of that, it irritates the gums. And once the gums get irritated, they start to swell. And when they swell, there's more blood that's getting pulled to the gums, which then causes bleeding. So normally the first sign would be like I would ask my patient that, when you brush your teeth, does it bleed? And they'll be like, yeah. So I'm like, okay, so how often do you brush or something? Because it would be now a representation of oral hygiene. But brushing 5 to 6 times a day is not actually going to help because the calculus is so hard, and because it contains like bacterial biofilms and that, it needs to be removed. So yeah, so I don't think a lot of patients feel that although they brush 5 or 6 times a day, they use the bath toothpaste, they use, multiple types of brushes and all of that, it's not going to resolve unless, it's removed, like, with our scalers and that.
All right. What, or rather, how is it diagnosed?
Okay, so basically, you'd come in, you would have the bleeding gums and be finally bothered by it and go into the dentist, and then we would go through a few diagnostic procedures, one of them being x-rays where we see the bone level of that is supporting the teeth. Then we would go on with it's called a probe, but it's actually like a ruler that we use to measure the amount of attachment that it has been lost between the tooth and the gum. So we see how much structure the tooth still has. We would then go on checking the plaque, doing a plaque index. We put a blue stain in the mouth and count the surfaces that have plaque involvement. So if certain areas of the teeth are bleeding, we would then, diagnostic tools, we would then class the patient and diagnose them into different categories of perio. So that is
All
how
right,
it's diagnosed.
And once you've diagnosed, what treatment is involved?
So the first line of treatment in any periodontal disease would be a cleaning. So depending on the severity of the cleaning, we'd get a normal cleaning where we can do without anesthetic, just to remove the calculus. But if the calculus is quite deep in that, we'd require multiple cleaning visits where we can remove all the calculus if it's attached to the root as well, followed by prescribing to the patient getting a good mouthwash or using a saltwater gargle, which is quite inexpensive, as well as maintaining good oral hygiene, which I think is the first thing. Like, getting your cleanups every 6 months, brushing morning and evening for around at least 2 minutes, flossing daily, then, maintaining your overall health, checking for diabetes, checking for any chronic diseases. If you're a smoker, to stop smoking. Whereas, yeah.
Yeah, that's it. That's how we treat perio.
Yeah, and then if it does become more like severe or something, then we'd have to take other approaches.
Which are more surgical approaches towards treating that sort of periodontitis, which will then be handled by a specialist who is called a periodontist. They would then do certain procedures where they clean at the root of the tooth, so create a flap and clean that whole root surface that is involved to try to remove that bacteria and get the bone to regenerate around that area and form and just be more strong in that area. So that is basically how we treat it, yes.
And how often should
it's also important to note yes, it's also very important to note that even when we do treat perio, it's never completely cured, that we would just clean it or we would just get rid of it to a point where there's stability, and then we just maintain the gum tissues.
Now, how often should we get cleaning by the dentist?
Uh, so, so we should be getting our cleanings done every 6 months. That's in a normal patient for maintenance and our cleanings. But in like periodontal patients, we do call them quite regularly every 3 months because that calculus or the bacteria that's in there, we need to get it out as soon as possible. So yeah, so normal routine dental checkup should be done every 6 months, worth a cleaning every 6 months. But if the disease does progress more severely, then we'd recommend that you come every 3 months.
Just to a point
All
where we
right.
can maintain.
And Dr. Vallabh, earlier on you mentioned about saltwater gargles. What other inexpensive home remedies can we adopt?
So the mouthwash is a lot of mouthwashes are quite good. Recommending like a mouthwash if you can afford it, but I recommend a lot of my times to patients a warm saltwater gargle. It prevents inflammation of the gums, it cleans out the gums, and it's quite inexpensive, and we have it at home. So doing it 2 or 3 times a day, if possible, is really good, and maintaining that for like a lifetime, like a lifestyle type of thing. Because if food and that does get stuck between teeth, at least the salt water helps to clear it out, as well as the infection or inflammation of the gums.
As certain other patients I've heard use turmeric, and
Yeah.
they add turmeric, salt, and water, and then they mix that together. So turmeric has been found to have antibacterial properties as well. So that also has been said to help with the swelling.
All right. Now, I'm worried about the staining from the turmeric. Will it not stain your teeth?
No. So it shouldn't stain unless there is a biofilm, like unless you have plaque. So you should make sure that you brush first. After brushing, there should not be plaque. The only time we have staining on our teeth is if there is quite a lot of plaque. If there's plaque, it creates this biofilm, and then anything is obviously gonna absorb pigment into it. So if the teeth are clean, then when you rinse with uh, salt water, it doesn't show. If you even rinse with well, not too much of turmeric, but like a quarter teaspoon, then that it doesn't tend to stain.
All right. I'd like to talk about some healthy lifestyle choices that we can make, what foods to avoid, what to include into our diet. But hold the thought, we're going to take a quick break and we will continue thereafter.
Solidarity and create an awareness of the plight of the people of Palestine. Support our initiative in providing medical assistance and food security. Donate towards our urgent appeal with your zakat, sadaqah or lillah. Visit our website www.pennyappeal.org.za or call 031 1100 573. Penny Appeal, Love Palestine. Penny Appeal, small change, big difference.
Med Medicine Depot Retail Pharmacy and Emergency Medical Depot. Conveniently situated in the Med Medical Center, corner Burger and Bottle Street, Pietermaritzburg. We provide safe, affordable and convenient medical facilities. Open till 10 p.m. every day of the year. We have a full house clinic that operates from 2 p.m. to 7 p.m., which is run by a qualified sister. The clinic offers immunization, vaccination, wellness, general consultation, and more. Call Med Medicine Depot on 033 3421 Med Medicine Depot, your pharmacy of choice.
What makes Randbury Jewellers the optimum place for your memorable gift? Is it our range of exclusive, high-end, luxurious jewellery? Or is it our master craftsmanship of all your bespoke jewellery needs? We believe it's because at Randbury Jewellers, we know just how to make your special moments last forever. Whether it's for a wedding, anniversary, or just a simple gift to show your love, trust Randbury Jewellers to make it special. www.randarejewellers.com. Make your moments last forever with Randbury Jewellers, the family name you can trust.
Rejuvenating media day by day. This is Salam Media.
Welcome back. You are listening to the Mid-Morning Talk on Salam Media. It is 11:46, and today we are talking periodontitis or gum disease, gum infection on our health segment, and I'm joined by Dr. Gounden and Dr. Vallabh. Doctors, thank you for staying on the line. Now, besides doing a saltwater gargle or turmeric and saltwater gargle, what lifestyle changes, because I feel like it's more important for us to change our lifestyle, the types of foods that we consume and what should we include and what should we exclude.
Okay, so I think in terms of dietary, we should have a balanced diet, number one, having enough of protein, carbohydrates, and fats. And trying to, I think, the easiest thing or is having less refined food. So less foods like your breads or rolls and stuff like that, and having more whole foods, including and accommodating a lot of like fresh fruits and vegetables, and trying to replace your carbonated drinks or your sugary drinks with more waters or fresh juices and that. And I think in terms of like, this the sweet and sticky stuff, like if you're gonna have that, try and just rinse your mouth and make sure that you do brush and all of that. So I think in terms of dietary considerations, having a balanced diet is very important. Trying to cut down a lot of fast foods, those are your refined foods, they're very high in carbohydrates and all of that. And I think one of that is a contributing factor to, overall health of like your mouth and that.
Other things could be, vitamin supplements as well, making sure that you get your vitamins. Lifestyle changes, including, exercising more, being more active, regular checkups with the GP, checking for comorbidities like diabetes, hypertension, and so forth. Also, lifestyle changes like cutting out cigarettes if you do smoke. Those are certain lifestyle changes that one could make to prevent periodontitis.
Yeah.
And what about with fizzy drinks?
So fizzy drinks or the carbonated drinks, like I feel like people should be cutting down a lot of them. It contains high sugar levels, and I think the acid in that causes a lot of damage to like the overall well-being of the mouth and that. But if you're going to have something like make sure that you do have something to rinse your mouth afterwards, or brush your teeth if you're going to have it at night. Brush your teeth before you're going to sleep. Or I also recommend to my patients, just chewing a sugar-free bubble gum, creating saliva in the mouth and that, so the acid and the sugar doesn't sit over the teeth and that.
Okay. Children, are they also affected by periodontitis?
Yes. So they definitely are. The type of periodontitis that affects children more is called juvenile aggressive periodontitis, which won't necessarily affect all of the teeth, but actually just certain teeth. So you'd find them on routine checkup because their oral hygiene is quite good. There's not poor oral hygiene in the sense that there's not too much of plaque accumulation. There's no calculus. However, when you take an X-ray, you find that the bone loss is quite significant, especially around the anterior teeth and the first molars. So yes, children do get it, but that is more of a genetic predisposition. So it's not all children, but sometimes when you're genetically predisposed, then you are more likely to develop juvenile periodontitis.
Okay, and if periodontitis is not treated, can it lead to something even worse?
Definitely, yeah. So with periodontitis, like ultimately you might end up losing all your teeth and all of that. But with that, periodontal abscesses do form in that. So abscess is like a collection of pus around the tooth, and that now we having pus there, which is like accumulation of bacteria and all of that. So it does lead to like infection spreading and that, and ultimately losing all your teeth. And a lot of research is showing that like once we lose our teeth and that self-confidence like does decrease, and your overall lifestyle and lengthlyhood of your life does get affected, because you don't eat what you like you normally eat. So that means that your nutrients that you are getting in is much less than that, so overall well-being is decreased.
All right. Much for your time. Any last takeaway points that we should consider?
I think most importantly to reinforce oral hygiene instructions, that we know how to brush and that patients are, educated in the sense that we're always going to go for your 6-month checkups. And from our practice, what we're doing is we have an initiative that's starting for our 6-month anniversary, where everyone in and around Johannesburg can come through to the practice and basically get educated about periodontitis, oral health diseases, and basically they will get their teeth cleaned and pay a donation for it. So they would just, anyone can just come through and get that done on the day. There'll be doctors there as well, and dentists just educating them about oral health, how to maintain for young and old. And basically the proceeds of the day will then go to feeding the community now, like the people in our area.
And the date, when will it be taking place?
So that will take place on the last Saturday of June. I think it's the 26th of June. We haven't yet finalized. But that is what we're doing. So basically patients are just reaching out, giving us their names, we're booking them according to a slot. And then we are then helping them on that day.
All right. So for more information, where can we go to get any information about confirmed dates, times, etc.?
Yes. So definitely they could visit us on Facebook and Instagram at KPMC Healthcare. That is KPMC, that is Cape Head Medical Center. We are situated in Randburg on Malibongwe Drive, and they could also just pop in to ask any questions and any queries. They could also contact us on WhatsApp, or on the number is 079 097 8811, just for more information.
All right. So thank you so much for your time and for that little education and insight on periodontitis. I think I hope some of us will be making better lifestyle changes and going for checkups and cleanups and whatever else that we need to do. Thank you and have a wonderful day.
Thank you so much.
That was Dr. Gounden and Dr. Vallabh, dentists based at the KPMC Healthcare in Randburg, taking us through periodontitis, gum disease, something that starts off as gingivitis, which leads to periodontitis, can also lead to you losing all of your teeth. If you don't want to be that person, make sure that you go for a checkup, but also just change your lifestyle. Change the way you do things at home. Have a nighttime routine. Have a morning routine. Brush your teeth as regularly as you can. I know back then we were taught to brush our teeth 3 times a day, because after breakfast, after lunch, and after supper, and now we learned that 2 times a day will suffice, and you gargle with a mouthwash, or you can use an inexpensive mouthwash of warm salt water. You can also add turmeric about that, but if you'd like some more information about things that you can do, you can go to, or rather send a WhatsApp message to 079 097 8811, and that's the WhatsApp number for the KPMC Healthcare dentists. And they will give you some more information, as well as the upcoming event that they will be having towards the end of June. And you can go there and find out more about the oral hygiene, what you can do, the lifestyle choices, what to avoid. They will be there, lots of information to be shared. And why not take advantage of the opportunity? But more information will be shared towards the coming of the event. It is 11:55. You are listening to the Mid-Morning Talk on Salam Media. Do stay with us while you enjoy this nasheed, and thereafter an ad break. And we will also go to Islamic Care Line for this week's segment. Do stay with us.